Morning, everybody. It's a little after 6 this morning. Just got back from an early morning run. It felt good to get out, get after it, get some miles on the shoes. Recently I had a conversation with a buddy of mine, and we were having a little bit of a back and forth about when the United States was its healthiest. And he postulated that perhaps it was years ago when we were more of a agrarian society where we had to actually get up and do hard work. And while I don't disagree with the fact that, sedentariness has become a problem, I did counter with the fact, modern modern medical technology has allowed us to, cure a lot of diseases and advance the longevity of our lives. And so there's some debates back and forth. But I think what was interesting is it brought up the point that we as a society have gotten a lot less active, a lot more sedentary, and we've started to consume a lot more calorie-dense, unhealthy foods. And it's had its effect, right? And I was looking at a report over the weekend from the CDC that was published a couple months ago that said the obesity rate in the United States is about 40 point something percent in 2022 to 2023, as measured by BMI over 30. And I believe, if I remember correctly, the severe obesity, BMI over 40, was about 9%. And what's interesting is if you compare back about 25 years ago to right around 1999, 2000, the same report shows obesity rates at about 30% and 4.5-ish% for severe obesity, respectively. So it's gone up substantially. And this is largely due to the factors that I mentioned, sedentariness, lack of exercise, and increased serving size of calorie-dense, carb-laden, poorly nutritious foods. And so I published a blog post over on my website where I was talking about this and some of the untoward effects. And we see in the emergency department all the time that severe obesity leads to hypertension, or obesity leads to hypertension and diabetes and kidney disease and heart disease and strokes. Even cancers have been linked to this metabolic syndrome that comes as a result of obesity. And so it's a very important aspect of health that we need to address as a nation, but it begins with us as healthcare providers. And this is the point that I was trying to make. If we want to be effective in helping counsel our patients towards a better lifestyle, we need to first model it ourselves. And so that is one of the many animating factors that gets me up and gets me running in the morning, is I want to be a good example for the patients of what I need to do. So when they say, hey, what do I need to do? I can say, hey, look, let's get some discipline on. Let's work on some nutrition. Let's work on getting out there, getting after, getting fit. And it doesn't have to be hard, right? The CDC recommends 150 to 300 minutes of moderate intensity exercise per week, which moderate intensity exercise they define as a brisk walk, right? So if you get out there and walk for half an hour to an hour a day, you're going to do huge numbers to help your health. They said you can also do 75 to 150 minutes of vigorous exercise, which is what we just got after it and got done. So hope this is helpful. Go over to the blog excellentphysician.com and check out the article about why we as healthcare providers should be modeling fitness for our patients. So go out there, get after it. We'll see you next time.